notice that you call your department mental well-being. Usually in hospitals, you have clearly the name psychiatric department. This is under what frame of initiative?
And this is partly about stigma, because we had a lot of discussion before we started, because usually, corporate, they don't start a department per se, and they don't put much money in mental health because there's not that much revenue. Like there's money in procedures, there's money in investigations and inpatient treatment and all those things. Whereas in, psychiatry, it's outpatient clinic, and then the inpatient is not covered by insurance. So I'm happy Anurup is here. Okay. So the insurance don't deal with mental health that much. So that's usually the private investors don't get into mental health, because you don't get the returns for how much you put in. But thankfully, we have a management who are more, ahead of times, and they said, look, if there is some huge need, so we'll create a more updated, very modern setup. And we have been here for 2 years, and thankfully, it's picking up, it's doing well. And here within, we are trying to approach other specialties, because see, the difficulty is also for other specialties. For example, a patient who with anxiety and palpitation, they would go and see a cardiologist because their heart is beating faster and faster. So they go and see a cardiologist. So if the cardiologist sees the patient and does the ECG, echo, everything, and they say everything is okay, normally they would just reassure the patient, everything is fine, you can, all good. So the patients, for the next 2 days, they're okay. Then they start to think, either maybe the doctor missed it, or the machine was not good, or there's a new specialist in a different hospital. So they go to the next hospital, get the cardiology again. So after 3-4 visits, finally one person would say, what, you better see a psychiatrist. Okay. So what we have done is we are working with our own cardiologists. This is about cardiology. You go to neurology, you'll see patients with headache, patients with the vague symptoms. You go to gastro, there are people who want repeated endoscopy done because they have this burning. So there's a lot of, in India, mental health difficulties present with physical symptoms.
Yes.
And the first point of contact is the physicians. And it takes a long while before they are referred to psychiatrists. Because if the doctor tells the patient, you go and see the psychiatrist after the first time, they'll say, okay, I came for a heart problem. Either you tell me there's a heart problem or not. Are you thinking I am mental? Do you want? So there's still that issues there. Yeah. So we are slowly kind of working with the cardiologist in how best to frame it so that they get, I usually joke with my patients, I ask them, okay, how much have you spent so far? It usually varies between 30,000 to 2 lakhs. And okay, so before they get referred
to the psychiatrist.
So we are working with other physicians to make it a bit more easy to, and we are a bit more accessible. So slowly.